Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be learning about diabetes and a new exciting diabetes support group. And our special guest is Erin Goff, a community health worker with the Frederick County Health Department. Erin, welcome. Thank you for joining us.
Thank you for having me.
All right, well, could we start off with you talking a little bit about diabetes? What is it?
Yes. With diabetes, the body is unable to process glucose properly. And glucose is a type of sugar. And glucose rises high into the bloodstream, which can cause damage to many different parts of the body. There are two types of diabetes. Type 1 is more severe and generally occurs in childhood. Type 2 is much more common and generally occurs in later adulthood. There are risk factors for diabetes that include being overweight, having a family history of diabetes, women who were diagnosed with diabetes during pregnancy, and being Native American, African American, and Asian American. There are currently 29.1 million Americans diagnosed with diabetes. There's 86 million diagnosed with prediabetes. That's 1 in 3 adults. There's also many different things that you can do for diabetes. But it is a serious illness, but it can be prevented and even controlled.
Wow, so those are some really sobering numbers. So as many as 1 in 3 persons have prediabetes?
Prediabetes or diabetes.
Or diabetes.
In the United States.
Wow, that's a lot. So if someone finds out that they have diabetes or have prediabetes, or I'll even add are at risk for diabetes, what can they do?
Well, the good news is that diabetes can be controlled or prevented with medications or making lifestyle changes of eating healthier and being more physically active. But the first thing you would want to do is make an appointment with your doctor to be tested. And if you are diagnosed with prediabetes, you would want to make those lifestyle changes of eating healthier and being more physically fit. If you're diagnosed with diabetes, you can be thankful that it's caught early, and you can make also the same lifestyle changes and also take the medications that are provided by your doctor. Also with diabetes, if you were to reach out to family and friends, it can also have a big impact on the diabetes itself by being more, giving you more clinical and psychological outcomes and also more beneficial activities for your lifestyle.
Oh, I see, right. So sort of if you adopt a healthier lifestyle, then folks around you will see that, and maybe if you're the one doing the cooking or the shopping, they'll also benefit from your healthier choices.
And reaching out to others can also widen the circle of control that you have over your diabetes.
Well, and that's a great segue into, I've been hearing about the diabetes support group, and with that you helped to establish, to form, and I'd like to hear a lot more about that.
There are a lot of different support groups for diabetes in the Frederick County area. However, the Frederick County Health Department has recently developed its own diabetes support group. And this diabetes support group is a little bit different than the support groups that are in Frederick County, just because the ownership of the group is within the group itself. And that's important because it allows the members to determine what they want to discuss and what they want to learn about. And it's also a safe place for them to come to share their successes and also the challenges that they're experiencing. There's been a few businesses that have come forward to offer their support to the diabetes support group. Through discounts, they've offered education and lifestyle and healthier eating, and they've also shared their successes that they've had with diabetes. And these two groups, it's Diabetics Delight, which is a local store, and also Seeds of Life Cafe, which is another local cafe that offers healthier eating choices. So the group itself would like to thank Dr. Kazmi, who allowed the group to form within his practice, and also the YMCA, who offered, a space for them to have their group. And then also Frederick Memorial Hospital has also collaborated with the group itself. So if you'd like to learn more, you can contact myself, Erin Goff, at 301-600-3332, or you can contact Teresa Shaver at 301-600-3335. So it's just a great way to get out and learn more about diabetes and also to get the support that you might need.
Okay, wow, that sounds terrific. So the diabetes support group, it is open to persons who have a diabetes diagnosis, maybe also called a sugar problem. How about, so I would imagine also though, people who have been told they have pre-diabetes?
It's open to anyone who has pre-diabetes, diabetes, and it's also, if you want to bring your family members to the group so that they can learn more about the disease and also be a support to you.
Boy, that's terrific. Before we close, is there anything else that you'd like to add?
Just that diabetes is a serious illness, but it can be controlled and prevented. But you have to act now for yourself and for your family and friends.
Boy, I like that. Act now for yourself, your family, and your friends. That's great. Well, thank you so much for giving us such good information.
Thank you.
And now please stay tuned for this month's Medical Myths.
Thinking about traveling out of the country this summer? As we get closer to peak vacation time, the race to get a passport is on. Now there's a new way to get your passport locally. Frederick County Public Libraries opened a new passport acceptance facility in the Seaver Arts Public Library in downtown Frederick. Located at 110 East Patrick Street, the office will accept passport applications on behalf of the U.S. Department of State. While tending to your application, you can also get your passport photo taken in the new library office. No appointments are necessary, as the service is on a first-come, first-served basis. The office is open Tuesday through Sunday at varying hours. For more information, visit travel.state.gov, fcpl.org, or call the library at 301-600-1630.
The Frederick County Sheriff's Office now offers fingerprinting services 3 days per week, from Tuesday through Thursday. Our goal is to make it more convenient for citizens to have fingerprints taken for employment, licenses, permits, and other important issues like adoption and child care services. The Sheriff's Office will continue to accept credit and debit cards, checks, and money orders as payment for fingerprint fees. Cash is not accepted. For more information, contact the Fingerprint Information Line at 301-600-4058.
Homegrown here is the tagline for fresh fruits, vegetables, and farm-raised products grown locally in Frederick County, Maryland. There are many places available to buy fresh, local products. Several locations offer their products at their farm market, while others use the 14 farmers markets around the county. To find out when and where these markets are available, visit www.discoverfrederickmd.com or call 301-600-1058 and ask about our agriculture industry. Remember, fresh, high-quality farm-raised products are homegrown here in Frederick County.
The Frederick County Health Department's On the Mark Adolescent Clubhouse and Sober Activity Center is a safe, community-based clubhouse which provides a starting point or continuing care link for peers supporting one another through the process of recovery. Membership is free and open to youth from ages 12 to 17 who are in treatment for substance abuse or are struggling in this area or who have completed a related program. The clubhouse offers fun and sober games, homework help, skills building, and many other activities. Located in the Health Department at 350 Montague Lane in Frederick, Maryland, the clubhouse is open Monday through Friday from 3:30 to 7 p.m. and Saturdays from 11 a.m. to 5 p.m. To learn more, call 301-600-1126 or visit frederickcountymd.gov on the Mark. Please also like us on Facebook at On the Mark Clubhouse.
And now here's this month's Medical Myths. This month's Medical Myths is about heart disease in women. Coronary heart disease is the #1 killer of women and men. The first myth is that it can't be a heart attack unless one has crushing chest pain. Well, that is a deadly myth. Women are more likely than men to report back or neck pain, indigestion, heartburn, feeling sick in the stomach, extreme tiredness, or problems breathing. Women are more likely than men to experience symptoms such as lightheadedness and dizziness. Women are less likely than men to report breaking out in a cold sweat. The second myth is that you can't do anything about your risk for developing heart disease. Well, that is false. It is estimated that 90% of Americans eat too much sodium or salt, which increases their risk for high blood pressure, which then contributes to heart disease and stroke. Physical inactivity, obesity, high cholesterol, high blood pressure, cigarette smoking, and diabetes are all risk factors that can be controlled. It is important that you know the signs and symptoms of a heart attack. Some people believe that they should try to sleep it off and that if it is a heart attack, then they will wake up and they'll still have the pain. That is, if they wake up. It is critical to seek professional medical attention if you or someone you know is experiencing the following symptoms of a heart attack: chest pain or discomfort, nausea, feeling lightheaded or unusually tired, pain or discomfort in the jaw, neck, or back, pain or discomfort in the arm or shoulder, or shortness of breath. Please remember the symptoms, and if you recognize them in yourself or someone else, seek immediate medical attention. That's this month's Medical Myths. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Frederick County Dental Services. Parents and children need to be educated on how important oral health is. Did you know that oral health is directly linked to your child's overall health? Poor oral health can lead to painful infections, poor nutrition, lack of sleep, and prolonged health problems. Every child deserves a healthy smile, and we are here to give you the proper tips to ensure the best oral health for your family. The Centers for Disease Control states that childhood tooth decay is still the #1 chronic childhood illness. The good news is tooth decay is preventable. Your child should visit a dentist when the first tooth appears or no later than his or her first birthday. Make sure you assist your child in brushing their teeth every morning and night, along with flossing once a day. Do not put your child to bed with a bottle or cup containing any type of milk or juice. Avoid consuming soda, juice, candy, or any sticky foods. Eat plenty of healthy snacks such as fruits and vegetables, cheese, and yogurt. There is an estimated 51 million school hours and work hours lost each year due to oral health issues in the United States. The earlier you take your child to the dentist helps with prevention and early detection of dental decay. Regular dental visits every 6 months will also enable your child to develop a sense of familiarity and comfort with the dental team. All of this information will help make a difference in this preventable disease. The Frederick County Dental Program here at the Frederick County Health Department is ready to assist you and your child's dental needs. Pediatric dental care is available for patients 18 years of age and younger. We accept all medical assistance cards. For patients without insurance, fees will be determined by income and family size. Thanks for tuning in to this month's health tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.
I'm Frederick County Executive Jan Gardner. From the shores of the Potomac River to the foothills of the Catoctin Mountains, with all the farms and bustling communities in between, there's truly something for everyone in Frederick County. Come and explore Frederick County's rich history and be part of our bright future.